Hi, I'm Jen DeSalvo, an internal medicine and pediatrics resident. This week for the Curbsiders Digest, I wrote about a recently published article in JAMA Surgery entitled Association of a Liberal Fasting Policy of Clear Fluids Before Surgery with Fasting Duration and Patient Wellbeing and Safety by Marson et al. This was a prospective quality improvement study involving tens of thousands of adult patients scheduled for non-emergency procedures involving anesthesia, some of whom were introduced to a liberal fluid fasting policy, which allowed clear fluid intake until arrival in the operating room, compared to the standard policy, which allowed clear fluid ingestion until 2 hours prior to anesthesia induction. Patients following the liberal fasting policy experience a clinically significant decreased median fasting duration compared to those following the standard fasting policy, which was the primary outcome of the study, in addition to secondary outcomes involving improved well-being measured by decreased rates of preoperative thirst, postoperative nausea and vomiting, and antiemetic administration. Those in the liberal fasting policy had a slightly increased incidence of aspiration and regurgitation, although this was within the study's clinically accepted risk margins. Therefore, clinicians should consider advocating for a liberal fluid fasting policy for patients prior to procedures involving anesthesia, and especially avoid postponement or cancellation of procedures if due to ingestion of clear fluids within 2 hours of anesthesia induction. It's time to change the meaning of NPO prior to procedures involving anesthesia to nothing present in the operating room.